The film goes into a lot of detail about many cases of people whose lives have been impacted by the lack of communication of information from one doctor's or practice environment to another. This is an issue that, if you look across all industries, has actually been solved as early as 100 years ago. Interestingly, not using technology. So the goal of this film was awareness. It was to basically allow us to talk about something that was going on in the health information exchange environment in Memphis, which I helped to evaluate and start, in a way that we could get to lay audiences.
So in other countries where healthcare is less fragmented, have you looked at other countries, and how is health information exchange going, and are there lessons to be learned where they have different challenges, in some ways not some of the same really hard challenges the U.S. healthcare system has, because their health systems have been different?
Yeah. What we're trying to do right now is fairly ambitious, which is we would like to literally create an open EMR across the entire United States. So it's not just ADT, which is admission, discharge, and transfer data, or meds, or problems, but all of it. And so you have to look a little harder to find some really good examples of that in other countries.
What we lack are incentives for hospital executives to exchange clinical information. So in our competitive system, how would you suggest we could pursue that goal?
I don't know that I have an immediate answer for an incentive other than to think about which groups are likely to benefit.
We showed this film at the Connecting Michigan for Health to a bunch of folks, and what it really conveyed was how hard the work is that we're engaged in, and how committed the people who are doing this work are to making it happen. The problem is that the health plans are not very interested in sort of dumping money into this sort of amorphous thing that may or may not produce results. How do we break this thing into pieces and show value in small chunks? The key message is that we have to find these areas of opportunity for alignment.
Tim, can you speak to the issue of sustainability?
The trick is 100% around getting the alignment to get people to say, I will pay for that thing because it's connected to the value. And what we've struggled with, and I again go back to use cases, that gives you a nice structured way to say, if we do this activity, this use case, you win, you get money, you should pay into supporting and making that possible. Now there's lots of different ways to move the money around, but I believe there's lots of sustainability opportunity.
When the design of the tool works, people use it. When the design of the tool doesn't work, when I have to log out, excuse me, John, for a minute, log in, wait, okay, there's a new pop-up. Now I have to remember my password and see new data. People do exactly what you saw in the documentary. They say, this just doesn't work for me. And they don't do it, not because it's not important, not because they don't recognize the importance, but because they're very busy and the workflow has to match, the configuration, the technology has to match those things.
From my mind as a practitioner, it's not just sort of being able to pass information back and forth, and Andrew, I think the statistics you gave are great, but from an evidence standpoint, what I think we need to really understand now and evaluate is what's happening to that information as it flows back and forth, and is it actually improving quality, lowering costs, or some combination of both to increase value. And I just want to close coming back to the earlier point about not just passing information, but actually passing knowledge and trying to organize information in a more effective way.
As I see it, this is really a circular problem, that until more patients demand more, many of these essentially politically thorny things are not going to get resolved. One of the things that, as a patient, I find most frustrating is even if I'm willing to go to the portal, the system doesn't use it. How can we make the workflow work better so that everybody who needs to be involved, and most importantly the patient, can be part of this?
The workflows that you currently see are very much based on each of us having a pioneering spirit and trying to do things the way we've chosen to do them with the resources we have, the talent we may or may not have, the configuration of our offices, our unique community of patients. And what's happening is slowly but surely it's becoming more standardized. So I do think that some of the challenge we're facing now is that growth phase.
I think the movie has succeeded in a very important way. As we reflect back on the movie and we reflect back on the discussion here today, the movie really did introduce every important issue. and touched every single base that is fundamental to the problem of health information exchange.